All right. So, all right. So now I'm no longer the only one here, but I did get a couple of questions prior to the meeting that I'm going to start with. And then if anybody has additional questions, I would be happy to answer those. And there may be a couple more people who join as we're going. So I'm going to shift my screen over to the questions that came in. Okay, and the first one, I'm going to actually, let's see if I can copy it and put it in the chat. Copy, I think I can. Chat. Okay, so there it is. It says last month you talked a bit about those with osteoporosis and the spine. I'm curious about doing cat-cow for someone with osteoporosis. Does this put too much compression on the front of the spinal discs and vertebrae? Okay, so cat-cow on a mat, on hands and knees, the spine is horizontal, it's perpendicular to gravity, right? So gravity is a force downward onto the back of the spine, as opposed to when we're sitting upright and gravity is aligned with the spine and is therefore compressing, okay? So as soon as you go into the position for cat-cow on all fours, you're already reducing the compression on the spine. That being said, when you're going into cat-cow, the cat, which is the rounding of the back of the spine and the drawing in of the abdomen, that does put compression on the front of the vertebral bodies, okay? As opposed to the arch of cow, which is not compressing the front of the vertebral bodies. It's the compression is in the back, okay? So cat-cow on hands and knees is less of a risk than cat-cow seated, even though cat-cow seated is the variation that we're more likely to use in a more gentle class, and I'll get to that in a moment. If you're doing cat-cow on hands and knees, my recommendation, as with all of the movements that we talked about last month, so both flexion and rotation, so cat-cow doesn't have rotation, but it does have flexion, is that you stay well within the available range. So when you get to the end of your range, in other words, I go as far into that cat as my body will go, now I'm pressing vertebrae on vertebrae, okay? And if I press even further into that, then I'm putting additional force on those vertebrae. Whereas if I stay within range and I'm moving comfortably within that range, then I am not putting as much force on the front of the vertebral bodies. So for somebody who has osteoporosis, especially, so osteoporosis being more severe bone loss than osteopenia, I would recommend that when you're doing cat-cow that you stay well within range. So you do want to mobilize the spine, you want to lubricate the spine and get synovial fluid moving and engage the core muscles that are going to help to support the spine and help to prevent further degradation of the spine over time. But you don't want to apply additional force by going to the end of range, and especially by putting any sort of force on the end of that range. Now, if you're doing cat-cow seated, you're already working against gravity. So the first thing when you're doing any sort of spinal movements, especially if you're in this vertical orientation where gravity is compressing the spine, is to lengthen. So create as much space as possible in the spinal column, and then again stay well within range while doing the cat-cow movements, and especially the cat, which is the flexion, which is greater risk for fracture for those who have osteoporosis. I also just want to remind everybody that if you have osteoporosis, it doesn't mean you have it in your spine. You have to find out where the bone loss is, where it's most severe, and you have to use that information in order to make intelligent decisions about your yoga practice. So for example, if you have osteoporosis in the neck of the femur, for example, then all of this is irrelevant to you unless you also have it in the spine. So that I just want to remind everybody that, like arthritis, you don't have arthritis in every joint in your body simultaneously. Even if you have systemic arthritis, not all joints are affected at any given time. And the same is true for osteoporosis. It's somewhere in particular that you have the bone loss. Now, the question here says, does this put too much compression on the front of the spinal discs? So the discs are not the issue, except that if you're compressing the discs, then you also are putting pressure on the vertebrae. So I just want to be clear that the osteoporosis is not in the discs. The osteoporosis is in the bone, the vertebrae. You could have other issues with the discs, and those other issues with the discs, like degenerative disc disease, disc herniations, for example, those also can be aggravated by the flexion and extension of cat-cow. So the challenge with osteoporosis is that it's not painful. I mean, that's sort of the blessing and the curse of it, is that you're not getting direct feedback about whether or not you're going too far. So you really do have to be mindful and careful and remember these guidelines. Whereas if you have something like degenerative disc disease, a herniated spine, sciatica, that sort of thing, if you go too deep into the pose, your body's going to tell you, because it's going to press on a nerve, or you're going to have some kind of discomfort. So with osteoporosis, you have to be much more mindful in the absence of that kind of direct feedback. Okay, so that was the first question. I'm going to go into the second question. Let's see, open this one. All right, the next one, copy. Forgive me as I move through these processes, paste. All right, okay, so this next question is, I've always found teaching the seated lunge hip flexor release by sliding the foot back very awkward. Many students misalign their leg/knee when sliding the foot back. Is there a different way to cue or slide the foot back? Okay, so I just want to clarify that we mean cue. So Q-U-E, not Q-U-E, just to be clear. Okay, so to cue, which is the cues are the verbal instructions, to slide the foot back in alignment, other thoughts. Okay, so just for those who may not know what this questioner is talking about, we're talking about being seated, okay? So you're seated and then sliding one leg back to come into a lunge. And my desk is sort of in the way. So let me see if I can slide back a little bit more. This is a laptop, so it's not optimal for this kind of video. You go from here, you slide the leg back, you get a nice hip flexor release. So especially if you're sitting in a chair for long periods of time, that's really great, because people who sit for long periods of time have tight hip flexors, and tight hip flexors can result in low back pain, which we know is an epidemic that's far more complicated than just having tight hip flexors. But we as a society are just, walking around with tight hip flexors like crazy. So it's a great idea to bring that sort of a hip flexor stretch into especially a chair class where people are seated for a long period of time and they're getting lots of mobility and lots of other parts of the body, and their hips are staying flexed. So you want to give them a little bit of relief from that hip flexion. Now, the questioner is saying that many students misalign. And I think that what she or he means is that as the leg goes back, the knee and the ankle are not in the same plane, or the knee is not staying in the same plane as the hip. I have to be honest, I teach this a lot, and I have never noticed that alignment was an issue. So one thing I would say is that as you're doing it, have the students move into it very slowly and mindfully and cue them to observe the alignment of the hip, knee, and ankle. One thing is when they're in seated Tadasana, they should be paying attention to the alignment of their hips, knees, and ankles in Tadasana, right? A right angle at the hips, a right angle at the knees, a right angle at the ankle, obviously dependent on sitting on the right height of chair. And then sliding the leg back, staying in that plane and tracking directly back. Now, if you're in a folding chair and you're trying to slide the leg back, the body leg, the leg from your body in between the legs of the chair, well, yeah, that's super awkward. So first of all, you can't see where your leg is going. And second of all, it's super unstable because as your leg is going back, the natural propensity is for the body to go forward in order to counterbalance it. And then you're like falling out of your chair. So not super safe and not super conducive to appropriate alignment. That being said, your body weight is not in your legs, right? Your body weight is mostly supported by your pelvis. So if your hip, knee, and ankle are not in perfect alignment, the consequences are very small. There's very little pressure or weight in those misaligned joints, and therefore there's very little consequence to it. However, it's a good practice to be paying attention to the stacking of the joints for situations where they are weight bearing. So for example, if you're doing a lunge on the floor where your body weight is in your legs, then it's really important that the joints be aligned because now you're putting pressure on those joints. Okay, so what I tend to do, instead of sliding the foot between the legs of the chair, is I go about this one of two ways. One is I take my body to the side. So now I'm sitting on the side. Instead of sitting in the middle of the chair and trying to slide my leg back, I sit to the side and then I slide my leg to the side of the chair, okay? And so that way I can pay attention to the alignment of the hip, knee, and ankle as it slides back. I also have this hand holding on to the seat of the chair on the other side. Sorry, I'm using a stool here instead of a folding chair, so it's not quite the same. But you see how I can hold on here, which stabilizes me, and I can slide this leg back and pay attention to it. It also gives me an opportunity for a nice side stretch, which feels really good. That being said, some people are going to feel a little unstable shifting so far to the right because now they have one sits bone off of the chair. So for a population that is not super stable, or for people who have larger bodies with more flesh to the sides of their hips, it's going to be less possible. Okay, so the other option that I use is exactly what I showed you in the beginning, which is to turn sideways. So now I've turned sideways, the chair back is to my side. So now I can hold on to the back of the chair, the chair back. I could also hold onto the back of the seat, and then I slide my leg back this way. And again, I can pay attention visually to where the hip, knee, and ankle are, and again, have an opportunity for a nice side stretch there. So those are the variations that I use instead of sliding the leg back between the body leg back between the chair legs. I'm not sure if the questioner has been doing it that way or not, but these are two other options. And then of course, paying attention, noticing where the hip, knee, and ankle are in space, visually looking to see where you are and whether you're aligned, thinking about it as an opportunity to practice healthy alignment for times when there is body weight in the legs, and it's more of a concern to make sure that alignment is appropriate. All right, so those are the 2 questions that came in advance. And now, are there any questions? So, hi, John, how you doing? I've seen you popping in and out. You're muted, so if you have a question, feel free to type it in the chat box, or you can unmute yourself and ask me if you have any questions.
All right, let me try doing that. I'll try the chat box.
Okay, so John is muted and he's going to type a question into the chat box. While he's doing that, I just want to say, you know, the vast majority of these questions have come from yoga teachers, and we have plenty of members who are not yoga teachers, but people who are living with arthritis who are using yoga or interested in yoga as part of their arthritis management lifestyle. So I want to encourage people who are living with arthritis to ask their questions also. There's no such thing as a silly question. The only silly thing is to not ask a question that you have, because whatever question you have, somebody else has it too. And don't think that because there are a lot of teachers in this forum, that they will find your questions silly, because they probably have them too. Also, for those of you who are yoga teachers, if you're teaching people who have arthritis, encourage them to become members, because general membership for people who are not yoga professionals is really affordable. It's either $15 or $30 per year, depending on whether you're a senior or a student or not. And you get access to, you know, a whole library of videos and lectures and, you know, all that stuff, as well as this Q&A forum. So especially if they have questions that you're not quite sure how to answer, of course, you as teachers can post them here and bring them to me. But it could be nice to recommend membership to your students, because there's a whole lot more that they can get out of it also. And I just, again, encourage general members, people living with arthritis, to feel free to use this forum for you too, not just for people who are teaching this work. Okay. John, I do not see a question in the chat box. You want to just try to ask it with your microphone?
I can do that.
All right, let's hear it.
Are you there? Okay.
Yes, I am.
All right. I'm working with a client who also has Parkinson's disease. And I've been trying to loosen up his joints. And now with his shoulders, he's starting to be able to move his shoulders. But now the bones are rubbing from the arthritis, and it's causing him a lot more pain. And I just don't know what to do. I'm thinking of trying to relieve the pain with CBD or aspirin or something like that. And I don't know if that's wise in the long run. So any suggestions you have, I would really be grateful for.
Okay, so I'm going to speak about this, John, in generalities as opposed to with regard to this particular client, only because I don't know this client, haven't ever seen him, haven't done an assessment, don't know his comorbidities, medical record, etc. So I can't give you any personalized guidance for this particular individual. But I will speak to the challenge of Parkinson's plus arthritis that you mentioned. I will also say, though, that recommending any sort of treatment that is not yoga is outside of the scope of yoga teaching and yoga therapy. And so it should be up to, unless you are a healthcare provider, then of course it's a different story. But unless you're a licensed healthcare provider, even recommendations about aspirin, which you might recommend to a friend, you should not be recommending in your role as a yoga provider. And CBD oil, there's just, there is so much variation in the quality of product and in the constituents and the processing of it and the effects. And so, of course, you shouldn't be recommending herbal remedies either because it's outside of our scope, but CBD is a particularly fraught area. So I would encourage this particular individual to consult with his healthcare provider and ask about pain management strategies that may be ancillary to the work that you're doing with him as a yoga provider. With something like Parkinson's, so there's a field called palliative care, which a lot of people confuse with hospice. Hospice is end of life, okay? So hospice is the kind of care that people use in order to remain comfortable without any extreme measures to continue life, like life support, et cetera. That's really different from palliative care. Palliative means pain care, okay? So palliative care can happen at any and all stages in the management of chronic disease. My mother, for example, was using palliative care for the 6 years that she was in cancer treatment. So palliative care is not for the dying. Palliative care is for people who are in pain. And so for a condition like Parkinson's disease, something that, especially somebody who is experiencing pain during the management of these two complicated conditions, palliative care may be a strategy. So something you could recommend is, have you talked with your doctor about palliative care? Because palliative care teams are very versed in all of the pharmacological and non-pharmacological strategies for pain management that are outside of your toolbox. So that's one thing. Also, think about what tools you have for pain that are not musculoskeletal in nature. Because I think when we're working with somebody who has a musculoskeletal condition and they're in pain, we think that we need a musculoskeletal solution, right? So we think, what movement should I be doing with this person in order to reduce their pain? And I'm not speaking to you on this, John, because I'm sure you're doing this already, but just for everybody else, breathing changes the nervous system, and the nervous system is where pain happens. Okay, so pain doesn't happen in your bone. Pain is a signal that travels along the nerves, and it's communication. The pain actually is communication from your brain to your body, telling your body what to feel. Your body tells your brain, hey, something's going on here, I'm not quite sure what it is. And then your brain tells your body, oh, this is what it is, it's joint pain. And then you feel it. So as a yoga therapist, you have the opportunity to affect those pain pathways through the nervous system, as opposed to actually changing what's happening in the skeleton. Okay, you can change the message from the brain to the body without changing what's happening in the body. And so John is adding that he's working on breathing, but the Parkinson's makes proper breathing a challenge. Yeah, and that's where I was going, John, is that because, so for those who don't know, the tremor that's associated with Parkinson's, as the Parkinson's progresses, the tremor is not just in the large muscles of the body. The tremor happens throughout the body, and it also affects the organs. And so as the Parkinson's progresses, it makes it difficult to engage in a smooth, continuous breathing pattern. So, so I would say, John, that's something to work on with this client to the extent that it is comfortable and not frustrating or irritating, right? So you don't want to spend too much time on it. And I think that with Parkinson's patients in particular, being able to be light and playful and exploratory is really important, because there's such a heaviness to this condition and the understanding that it's progressing, that being able to be playful is really important. Also, just as a general note, we think of asana as being static poses that we hold the body in, right? Like you stand in mountain pose or in tree pose or in warrior pose, and you stay there and you hold it for however many breaths. If you have Parkinson's, especially if the Parkinson's is progressing, there is no holding any sort of position. So, of course, our bodies are all moving all of the time. When you and I are in mountain pose, our body is constantly moving. And you know that because if you close your eyes, which means withdrawing your senses, you can feel all of the little adjustments that are being made on the soles of your feet in order to keep you stable in that pose. And that's because your body is a machine that is in constant movement, right? And you're just able to continuously and subconsciously adjust to that, so it gives the appearance of being stable. But when you have Parkinson's, all of those movements are larger and exaggerated and more visible and more palpable. And so trying to hold a pose statically can be frustrating. It can also be embarrassing, and uncomfortable and unstable and even unsafe. So when I'm working with somebody who has Parkinson's, and I am not an expert in Parkinson's disease by any means, I'm an expert in working with arthritis and rheumatic diseases, but I use movement more than I use postures. So I use sequences and, shaking things out and rolling things and things that allow movement, so that any movement that arises from the tremor is part of the experience of the practice. And also, there tends to be less of a tremor when people are in movement, which is one of the reasons why dance is actually used a lot for. I actually have a good friend and colleague who uses dance with people who have Parkinson's, and it really is transformative. Okay, so John jokes me playful with a smile. So yeah, I'm sure that won't be a problem for you, John, to incorporate playfulness. Now, John, remind me, because I've lost track a little bit of the question, specifically where the arthritis is. It's in the shoulders, did you say? I can hear you typing, so you may as well speak.
Okay. He's got OA totally through his body.
Okay, but where is it causing him discomfort during the practice?
It depending on what we're doing, it's always in the shoulders.
Okay.
And this, I wanted to ask you this earlier, because this, I don't want to digress from where we are, but I didn't know he had Parkinson's. I gave him the questionnaire to fill out.
Yeah.
And I went through it, and after a couple of weeks, really soon, I noticed that there's something else going on here. And his wife says he has Parkinson's, and I go, "Excuse me, you never said that." And her answer was, "Everybody knows that. I didn't." And so I've learned about Parkinson's a lot.
Yeah.
But okay. Now I'm getting better. He's recovering. He doesn't recover, but he's getting better at the symptoms of Parkinson's. Mm-hmm. But now the pain from the OA is really getting to him.
Right.
And now he'll stop, and the Parkinson's will take back.
Right. Yeah. So I think what's challenging about the convergence of the Parkinson's and the arthritis is because, remember, one of the things that exacerbates arthritis pain is repetitive motion. So if you have a tremor that is causing involuntary repetitive motion, that means that there is a constant rubbing in that joint that's going to exacerbate
he doesn't have
arthritis. Oh, he doesn't have tremors.
He
Okay,
doesn't have
here
any
I am
tremors.
going off on
No,
all these tangents about
I thought you
tremors.
meant like there was something called a micro tremor, but
Okay.
no, he has no tremors.
Okay, so it's just arthritis pain,
Right?
shoulder pain
Yeah.
from
And,
arthritis. Okay.
and well, it's in his hips, it's in his
Yeah,
lower back,
right.
it's in his hands,
Okay.
and so and he works through the pain, Steph.
Right.
He
Yeah,
works through it.
right.
But then as he's become loosened up, now the bones are really rubbing
Right.
together.
Right. Okay. All right. Totally different. I was thinking that the bones were rubbing because of a tremor. But I'm glad that you brought this up because it brings up the issue of, yes, we have to do our due diligence and do go through the intake process and try to understand what's going on health-wise with our clients. And also, sometimes you don't get the whole story. In fact, I would say most of the time you don't get the whole
That
story.
that was one of the questions I wanted to ask you when we couldn't get through on the seminar
Yeah.
remember a couple of months ago wouldn't go through. We had a
Yes.
problem. Yeah. So
Yeah. So, I mean, so you can put questions on there like, is there anything else I should know? Do you have any other conditions that I haven't asked about? Is there anything else? You can ask those sorts of catch-all questions, but sometimes people are not forthcoming because they don't want you to know. And especially with a new client, they may not be ready to disclose something to somebody that they don't know, that they don't have a relationship with, especially trauma history, or any sort of a sensitive diagnosis that may have a stigma to it, right? So that's always a possibility. And frankly, they forget. They forget to mention things, and especially maybe the things that are most obvious. So, and there may be more to that, but I would say it's pretty common, this story of, well, I did an intake, but they didn't tell me this.
that
And
was
even
it's common. That's what I thought.
it's
It happened.
common, and also even more so. So, okay, so if it's in writing, it's more common because they're just like trying to get through it and they're not necessarily being incredibly thorough. So I would say it's less common when you do a one-on-one. I try to get a written intake, but then in my first session, we go over it together. And I ask because usually there's something on the intake that's not clear, or that I want to ask follow-up questions to, or that I need some more specificity about. So I usually do some sort of a conversation going through that intake together to make sure that I have as much relevant information as possible. So if we're having those sorts of communication barriers in this individualized and thorough of a process, think about those situations. For those of you who are yoga teachers in a group setting, those of you who say, does anybody have any health conditions that I should know about? Okay, so if you've trained with me, you know that posing a question like that to an entire group of people is a no-no, because it's asking them to disclose health information to a group of strangers, which is violation of HIPAA. Even though as a yoga teacher, you're not bound by HIPAA, you should act as though you are. So even if, as people come in, you're able to take a moment with them one-on-one and ask them, obviously you're still going to get less information than you would if you could do a thorough, proper intake. Not everybody has the luxury of doing that, but at the very least, try to get a sense of if they're having any physical discomfort that day that you should be taking into consideration, or even emotional challenges that you should be taking into consideration that day. So for shoulder, Sean, I want to understand the question better. Are there specific movements that you're doing that are causing discomfort in his shoulder?
He can't lift his arms.
Yeah.
He
Okay.
can't lift his arms above 45 degrees without
Yeah.
comfort. Well, Sometimes he can, and sometimes he
Okay.
can't. But
So don't.
and that's what we do.
Right.
That's
Right.
what we do.
Right.
But we have to do some movement.
Right. You want to do some movement. You want to, because again, move it or lose it, right? You want to use the movement that's available in that joint, but not to the point of discomfort. And if he's unable to take his arms above 45 degrees, then
We just don't do it.
yeah, then don't do it. And, it's probably a good idea for him to consult with his doctor about whether there are any other, options available to manage his shoulder.
Is there a whole group here that I'm taking up a lot too much time?
No, you actually are the only one who showed up live today. I answered a couple of questions that got sent in advance. So you're fine. But I just want to be clear that I'm not giving recommendations for this particular person. I'm just saying if someone has shoulder discomfort, then don't do anything, don't, if there's a saying we use in yoga for arthritis, no pain, no pain, or no pain, healthy brain. You don't want to do anything that's going to put people in more pain and discomfort when they're coming to you to address their pain and discomfort.
I know exactly what you mean.
Yeah.
And the thing that's, how do I want to say this? But he's amazing. He's inspiring to me but he needs this strength, because when I started working with him 2 years ago, he was falling at least once a day, at least once every day. And he's a pretty solid citizen. He's not fat, but he's solid. And
that's very risky.
What's risky?
Falling.
I know. And we went through a period a summer ago where he went 3 weeks without a fall.
That's great.
So he's getting better.
Yeah.
And he's enthused about it, and he wants to get stronger. So we use rubber bands and a whole variety of things.
Right.
And
you're doing stabilizing practices, I'm sure, that are helping him to ground.
But here's the problem with the stabilizing, as it took me a long while to figure this out. Is okay, we go like this, and his fingers are going, he can't do this.
Right.
So we're working on that, but it's also with his toes.
Oh, yeah.
So he can't grip.
Yeah, so let me just say something about that, John, because for anyone who has reduced mobility in their feet, and that actually can happen as we age, and that can contribute to falls.
It does happen. It will.
So rolling a tennis ball.
I do it.
The sole of the foot, right? Massaging the foot, like bringing the foot up and doing. I'm not just saying to you, John, but because this is getting recorded. So for anybody who's listening, massaging the sole of the foot. I have my daughter who grips with her feet. I have her soak her feet in Epsom salts and roll a tennis ball around in the water. And then she's amazed. She gets out and her hamstrings are looser. She's like, oh, wow, I can touch my toes.
I've seen that. And we've talked about that, how you can hold, if you work and flex your feet like so, and people will admit that if you do that, you can hold tree pose, Vrksana, much. But
right. Because the fascia that's on the sole of your feet is going up the back of your leg, right? So you loosen that up and it loosens up the whole, and also articulating the feet. So, exercises where like trying to press one toe at a time down into the mat, rolling front and back.
I've got to get them open before I can press them down.
Yeah. Oh, right. Sure. So another thing, spreading them out, putting the fingers between the toes and spreading them. You know what I'm saying?
That the exercise that Krista showed, I guess about 6 months ago on Facebook, I think, about walking the fingers. Man, that's been a game changer for him.
Oh, wonderful.
I mean, and I will talk to you later.
Okay, wonderful.
And make sure you pat that really nice dog that's sitting behind your left shoulder.
I will. She tries to make an appearance in every video.
She's important.
Absolutely.
Thank you for all you've done.
Oh, absolutely,
It's
John.
been a lot. You've done a lot.
Thank you.
Yeah.
Have a great weekend.
Okay.
Okay,
Bye-bye.
bye-bye.